Hi, I'm Steve Stahl, and I'd like to talk to you a little bit about the clozapine handbook that I wrote with Jonathan Meyer. Clozapine has been a very interesting drug. Some people say it's the gold standard for treating psychosis, and yet other people say nobody uses it. I think people are afraid of clozapine because it can have side effects, and it should be used a lot more than it is, and it tends to only be used by experts that treat very sick patients. And the bottom line is that the recommendation for the use of this drug is much higher than the actual use of this drug. Having seen that, Jonathan Meyer and myself thought it was time to get out some information that might close the gap and make people more familiar with the drug and less afraid of it so that they could, with more confidence, go ahead and prescribe it. So a lot of the drug is about managing the side effects. One of the hesitancies is, oh, am I going to prescribe this clozapine? What if I get this side effect? What if I get that side effect? What am I going to do? I just don't want to deal with it. So to be able to prescribe clozapine means to be able to understand, recognize, and manage any side effects that come up. And that's really what we're telling you in the book. It's not that hard. But it does take some expertise. And this is the very expertise that we feel that psychiatrists should have. If you're going to be a prescribing psychiatrist and treat patients with psychosis, you must know how to use clozapine. Why is clozapine so effective? And the answer is GOK. God only knows. So I'm being a little cynical here, but really it's a mystery. It has properties that drugs have tried to mimic because clozapine, although it is the gold standard of efficacy and can be really better than any other drug to treat psychosis, also has many side effects. So we have tried to answer the question, what makes clozapine different? How does it work to cause this extra efficacy? And have looked at the various binding properties on the drug and have imitated them with other drugs. And yet we failed to actually produce a clozapine without side effects. So we don't know. We do know that the mechanism of side effect is not why the drug works. So it's theoretically going to be possible to pull out the special efficacy and make it more tolerable, but we have not found the molecular mechanism for that. And that is the reason why we're stuck with clozapine, because there's no way to duplicate it right now. Maybe someday there will be, and then we can get rid of clozapine. But right now, if you want to have treatment response to patients that are very sick and not responding to the drugs, you must know how to use this agent. And we don't know why. I mean, I'm being humble, I'm being honest, but we don't really know why it has special efficacy. Well, clozapine is a drug for psychosis, or so-called antipsychotic actions. So clozapine can work for any form of psychosis, but really it's the schizophrenia psychosis that has most of the evidence and most of the use. It can be useful in really bad cases of manic psychosis, and off-label and theoretically it can be used for other types of psychosis, but it's treating psychosis and the big problem, patients with schizophrenia that don't respond to other drugs for psychosis. So they have to use clozapine. Mostly it is schizophrenia.